Alright, hello everybody, it's Dr. Earle. We're here at Pure Plastic Surgery and it's hump day with Dr. Earle. Alright, and so today I wanted to start off with talking about the cell saver. It's been a little while since we've talked about it. A lot of people are not exactly sure what it is, how it works, and things like that. So I wanted to kind of bring out the actual machine here today so I can show you what it looks like. And then also some of the components that go with the machine in order for it to work, okay? So here we have it. This is the actual cell saver machine, okay? And essentially, if you really kind of want to boil it down, what it does is that it's able to basically, you know, filtrate your blood from the remainder of the fluid, okay? Basically spin it down, centrifuge it down, and then put it back into an IV bag, which we can then kind of give back to you, pretty much like an AutoTransfusion, okay? You can think of it that way. So we use it for the big liposuction cases, for Lipo 360 and for BBL. And so just to explain why it works for those cases and not for something like, say, a tummy tuck or my makeover, okay? So when we do a Lipo 360 or BBL, the first step in any of those cases is we're actually infiltrating Tumescent fluid, okay? This is a fluid, basically, usually I use saline with epinephrine, okay? And what it does is that it basically constricts the blood vessels, and the purpose of the Tumescent fluid is to decrease bleeding and to also decrease trauma during the liposuction procedure, okay? And we actually infiltrate quite a fair bit of this fluid. We put in, typically, the average is about 2 liters in the front and then 2 liters in the back. So a total of 4 liters or 4,000 cc's of this fluid, okay? Then we go ahead and do the liposuction. And when you do the liposuction, we're not just removing fat, but actually 3 things are being basically removed with the liposuction. 1 is the fat, of course. 2 is some of this Tumescent fluid. And 3, there's going to be a certain amount of blood in that fluid. Okay. So once we've removed all that, you know, the lipoaspirate is what we call it, which is all those 3 components, we then allow things to settle. Okay, and the fat is going to go towards the top, and then beneath that is going to be the combination of the fluid plus blood. Okay, so that's when the cell saver comes in. We then are able to aspirate, okay, that bloody fluid into the cell saver. Okay, it then passes through multiple filters. Okay, and it separates your blood from everything else. Okay. And then it basically concentrates that blood into an IV bag, and then we can give that back to you, okay, essentially as an AutoTransfusion. And what are the benefits of that? Well, of course, that means that you're going to have overall less blood loss for the case, okay, so less anemia than you would otherwise, all right, and that means that your recovery is going to go a lot better, a lot smoother, you're going to feel better, stronger, okay, and you're just going to recover faster. All right, and your chances of needing a transfusion are less. Okay, they're not 0 though. They're not 0. So some people ask, you know, well, do you have a cell saver? Is it guaranteed that you're never going to need a transfusion? No, the answer is no. Like anything in medicine, there's never a 0% chance or a 100% chance. Okay, so does it decrease your chance of needing a transfusion? Yes. Is it a 0% chance? No. Have I had patients who have had the cell saver and unfortunately needed a transfusion? Yes. Okay, it's rare, but it can happen.
So would you say those are some negatives to cell saver, or if not, are there?
No, I don't think that would be considered a negative. I think that it would be even worse off if you didn't have it. Okay, so I think the cell saver overall is very, very positive, and I do highly, highly recommend it pretty much for all my Lipo 360 cases and all my BBLs. Okay, but one question that does come up, you know, is you know, how does it work in terms of, like, you know, different patients, like how do you clean it, or you know, these types of questions. So what I wanted to point out today is that the components that are actually what kind of goes or fits inside the machine, they're all of course sterile and they're all single use. Okay, so you use 1 component per patient. Okay, and once you have that bag of the blood that you AutoTransfuse, you throw everything out. Okay, so it has all these, you know, sterile components that are single use only. Okay. So one of the first things that we have is here in this green package here. But this is essentially just some tubing, okay? This is the sterile tubing where we suck out the fluid from the container, okay? And it goes into the big canister, which you can see here, Are you able to see that there?
Mhm.
Okay, all right. So this canister fits in here. This is the suction tube in the back, which connects to this here. So you remove the fluid, you suck it into this canister, and that's the first step. Now, if you can see here, there's like a black kind of foam looking inside it. That is your first filter, kind of your preliminary filter, okay? Anything that's kind of like big, you know, like if for whatever reason, say a little fat chunk gets in there, or, you know, some fibrous tissue or anything like that, it's gonna get caught by this initial preliminary filter, okay? Once it gets through there, then it goes into like the real workhorse, which is this one here. Of course, like, you can't really see the components right now because it's sterile and I don't want to open it, but that's what actually goes inside the machine. That's where you have the heavy-duty workhorse centrifuge type filter, where it really kind of spins everything out, and in doing so, it removes anything that's not your own blood, and it concentrates your own blood, okay? And that's the component that goes inside here, okay? Right in there. Once it does that, then it all kind of shoots up into an IV bag here, okay? And then that's the bag that we can then use to transfuse the patient. But we're not done with the filters yet, okay? Just for an additional kind of peace of mind, all right, there's an additional little tiny kind of final filter. Can you see that okay there?
Yes.
Yeah? So that additional little tiny filter is what then connects the bag to the IV line and then towards the patient. So let's see. This is just regular IV fluid here, but just to kind of demonstrate things, when you have just your regular IV bag, it goes straight into the line that then goes into the patient. But when we're doing the cell saver, this of course wouldn't be just IV fluid; it would be your own blood. We then attach this additional filter right there, okay, and then the line, so you have one more added kind of layer of protection there, okay? So I know a lot of patients or followers always ask, well, what happens if there's something else mixed in there? Like, what if there's fat in there? Will they get a fat embolus? Or what if there's some fibrous tissue there, or et cetera, et cetera. So there's basically 3 filters, okay, that are able to remove everything else, and so what you're left with is just your own blood, okay, and that's why we can give it back to you with no issues.
How much Tumescent fluid do you add prior to the liposuction?
Right, so that's a great question. So it does vary a little bit from patient to patient. So typically bigger patients will have more Tumescent fluid than a smaller patient. But the average is about 4,000 cc's or 4 liters. So typically around 2 liters in the front and then 2 liters in the back. If you're a bigger patient, it may be more like 5 or even 6 liters sometimes. And if you're a smaller patient, or even if say it's like you're round 2 or round 3, where things are always a bit tighter, because there's fibrous tissue, scar tissue, and things like that, typically you can't get as much Tumescent fluid in, so maybe something less than 4 liters.
And do you wait a while for the Tumescent fluid to work? Does that give you less bleeding before the surgery
Exactly.
starts?
So that's a great question. So what components are in the Tumescent fluid that we use at Pure? So different surgeons have different formulas that they like to use for their tumescents. So mine is actually pretty simple, pretty straightforward. So we use the saline, and in the saline we put in epinephrine, which is a vasoconstrictor, okay? And that's it. I don't use anything else. Certain other formulations do have lidocaine, okay? But since I do all my procedures under general anesthesia, there's no need for the lidocaine. I don't like to use lidocaine because it could potentially increase risk for lidocaine toxicity. Okay, if you put in too much lidocaine, that can cause problems. So that's pretty much a zero. That's one of the things that is a zero risk with us, is because I don't use lidocaine at all. So there's a zero risk of lidocaine toxicity. Now, the epinephrine does take a little while to work. So you want to infiltrate the Tumescent fluid, and you want to wait approximately 10 to 15 minutes or so for that epinephrine effect to take place to vasoconstrict those vessels. And therefore there's going to be much less blood loss throughout the surgery.
Do you need a cell saver for mommy makeovers?
Right. So that kind of goes to the second part of the question. Typically, what procedure do you use it for, and what procedures is it not useful for? Okay. So, like I said, useful for lipo 360 and BBL, but it's not useful for your tummy tuck, say breast surgery and mommy makeovers. Okay, why is that? Actually, because the blood loss for those procedures is pretty low. So there's really not a lot of blood loss, really not enough really to really run through the machine. And so, there's really no need for a cell saver for those types of procedures.
Do you, after cell savers, this is a little off topic, but when can you get IV therapy after surgery?
All right, so typically you can do it next day. Okay, so post-op day 1, it's okay to do some IV therapy. That'll help you with your hydration. Sometimes there can be some vitamins in there, which is okay. But is IV therapy absolutely necessary? Not always, but it is okay and it can definitely help. But really the key is that you want to make sure that you stay very, very hydrated after surgery. Okay, so you want to be drinking at least a gallon a day, but somewhere between 1 to 2 gallons a day. And that should be a combination of water, Gatorade, and pineapple juice is helpful as well.
How long does the cell saver take to replenish your blood? Do you wake up with it still working?
Okay, great. So once we do, say the first component, which is typically from the front, okay, we run that initial fluid from the cell saver, it starts to accumulate. Then of course we turn the patient, we do everything from the back, and then run it again, okay? And then it depends a little bit on basically how long the fat transfer portion of it takes. So a lot of the times we start it here inside the OR, okay? And it may be done, by the time we're done with the fat transfer when we're waking up the patient. But sometimes if it's not done yet, that's okay. The patient kind of carries it with them to recovery, and then we make sure that we finish everything in recovery before the patient goes home.
It's a question about this whole process. What about the 4-liter max fat amount? I'm confused. Yeah. If so much fluid is put in, does that affect the amount of fat that's taken out?
No. So remember one of the first things that I said was, so once you remove the lipo aspirate, which is the combination of everything, right? Then you allow the fat to settle, which settles towards the top. So fat is less dense than water, so the fat settles towards the top, and then you remove the bloody fluid underneath. So what you're counting is strictly the fat, or what is more specifically called the supernatant fat. Okay. So when you're talking about the limits, okay, the 4,000 cc limit of fat removal, you're talking strictly about the supernatant fat. You're not talking about the tumescent fluid. You're not talking about the blood or any other component of the lipoaspirate. Excuse me. You're talking specifically only about the fat, and so that's what you count when you're talking about the 4,000 cc supernatant fat limit.
So how do you address patients' pain upon awakening from general anesthesia if you don't use lidocaine?
So pain is addressed, through pain medication, basically. So while you're here, you get that through the IV, or also, while you're under anesthesia and in recovery, and then of course at home you get it through oral pain medication.
Is the cell saver included in any surgeries, and can you add it, let's say, to a breast augmentation or anything?
So again, it's only going to be used for the big lipo cases, so lipo 360, BBL. And yes, our packages here at Pure typically tend to include it already within your package. It's certainly not necessary for any breast case, mommy makeover, or tummy tuck. It's not going to be helpful in those situations, in those cases.
And do you know a different, just from hearing your patients, any patients who have had cell saver versus the ones who haven't? Is there a difference in their energy levels or how they feel?
Yeah, so I think overall, yes. I think overall the patients do much better with the cell saver. They do feel stronger. The recovery goes smoother, and they're up and walking more. There's less lightheadedness and things like that. And certainly they would do better than if they had not had the cell saver. Okay. Does that mean that all patients feel absolutely fantastic after the cell saver? No, but I do strongly feel that they feel better than they would otherwise, and so that's why I strongly recommend it. Also, it's what it allows our low hemoglobin level to be at 11. So typically, if your hemoglobin level is 12 or above, that's pretty safe for a big lipo case. But certainly, if it's between 11 and 12. The cell saver becomes very, very important. And if it's below 11, then you're just not a candidate at that time for lipo 360 or BBL.
And for your out-of-state patients, how many days should they stay, let's say, for the Lipo 360 post-op in Miami? And is that the same for all procedures?
So for all procedures under general anesthesia, including Lipo 360, you got to stay in Miami a minimum of 5 days post-op. Okay, not 5 days for your total stay, but 5 days post-op. So what does that typically translate? It translates to at least a week here in Miami, because you have pre-op day, which is going to be the day before surgery. Then you have, of course, your operative day, and then is when you start counting the 5 days after that.
And the recovery time just after a Lipo 360?
So yeah, so in general, so kind of general recovery. Typically, most patients by about 7 to 10 days after surgery, they're ready to go back to kind of office-based settings and work where you're not doing a lot of heavy lifting or strenuous activity. A lot of people ask about driving. Usually around 7 to 10 days, the patients are feeling comfortable with driving as well. But it is going to be 6 weeks of no heavy lifting, no strenuous activity, and no swimming or submerging the body underwater. Okay. So for heavy jobs, like firefighters or police women out there, flight attendants, things like that, you may want to consider taking 6 weeks off.
What's your advice on patients who are planning to have kids after BBL? Should they wait to have the BBL after having kids, or is that okay?
So pregnancy is going to change your body. I mean, that's just a given. Okay. Can you have a BBL before pregnancy? I think so. I mean, certainly, that's going to alter your body shape. And I think I've seen a lot of women who had a BBL, then had pregnancy, and they were able to bounce back fairly well. Okay. So I think doing a liposuction procedure or a BBL before having kids is very, very reasonable. What I think is something that's not as much, probably not as reasonable as having, say, for example, a tummy tuck before you're having kids. Because that for sure, it's pretty much guaranteed that you're going to need another tummy tuck if you do become pregnant. Okay, because that skin is just really going to stretch all the way out again. After the 9 months of pregnancy, and then typically you won't be able to bounce back very well, and then you'll be left with loose skin again. So kind of in conclusion, I think lipo and BBL very reasonable to do prior to having kids. But a tummy tuck is probably something you may want to consider after you're done having kids.
So does adding cell saver to my surgery, does that add time to the surgery?
No, because actually the person who's really kind of in charge of the cell saver and running the cell saver and everything else is anesthesia. So I'm still doing the case. We're still working along, moving along. So it doesn't really doesn't really alter your surgical time one way or the other. It doesn't really alter your time in recovery either, because most of the time we get it all into the patient before their kind of hour or whatever the time they need in recovery as well. So really in terms of timing, it doesn't make a difference.
So the blood that's left in the bag that's getting replenished back to the patient,
Yeah.
do you wait for that bag to empty out, or just sometimes is there any left over?
No. Why would we do that? We would just be throwing it away. No, of course. We want to give it all. We want to give as much as we can back to you, so that your hemoglobin level kind of goes back up a little bit. So I don't know. Let's use some simple numbers. Say you start off with a hemoglobin level of 12. Okay, and then we give you some IV fluids. We do the liposuction. Okay, and then theoretically, say we were able to check it before we did the cell saver, say we dropped it down to 9, okay? But now we pass the fluid through the cell saver, okay? And then we give all, as much as we can back to you, okay? And then, once we check it again, you're probably going to be somewhere like around, say, 10.5 or so, okay? So whereas if you didn't have a cell saver, you'd be walking around with a 9. Okay, with the cell saver, you're now walking around with a 10.5, which means you're going to feel a whole lot better, less lightheaded, stronger, recover faster, etc.
Would you consider giving love knocks after BBL to prevent blood clots?
I don't like to do that because Lovenox will increase your chances of bleeding. Okay, so why do some people use it? Some people use it because they're wanting to prevent a blood clot or a DVT. Okay. But so that's the upside. The downside to Lovenox is that it thins the blood and increases chances of bleeding. So For a BBL, I don't think, in my personal opinion, I don't think it's worth it. So I don't use Lovenox. I give very strict instructions for the patient. They got to be using their compression stockings, and they got to be walking, and they got to keep the circulation in the legs moving, which is really what's going to prevent the DVTs without having the added risk of bleeding with the Lovenox. Now, the other thing that you can add to that, which I do highly recommend, and some of you have probably heard me talk about it here, is the Circulate sequential compression device. So the Circulate wraps around your calf, okay, and it creates like almost like a massage, but it squeezes and lets go, and keeps the circulation in the legs moving, especially when you're not being inactive or when you're sleeping at night. And again, that also greatly decreases the risk of DVTs. And so if you want to be extra safe, rather than using the Lovenox, I would recommend using the Circulate sequential compression device. Sequential compression devices have been shown to be just as effective as Lovenox, okay, for cases like these. And so therefore, that's what I would highly, highly recommend.
How many BBLs do you do per day?
So typically I cap it at 4, okay? So I do the max cases I do per day is 5. I don't like all of them to be BBLs. I prefer to kind of do a little mix in there. So the cap is 4 BBLs, but for most days we'll do about 3 BBLs and then 2 other types of cases where it's a mommy makeover, tummy tuck, breast lift, or something different.
Thank you. Is around 2 BBL longer OR time than around 1?
Not necessarily, but around 2 BBL does tend to be more bloody basically than around 1 for most cases, and that's because there's more fibrous tissue, there's more scarring, okay, and therefore they do tend to be a little bit bloodier than around 1, and that's why for around 2 lipo 360 or BBL, the cell saver is mandatory, okay, regardless of what your hemoglobin level is. Your hemoglobin level can be 14, and still it's going to be mandatory for around 2.
Is it okay that I got my vaccine? My surgery is in May.
Yeah, so, I think nobody knows the answers for sure because all of this is very, very new. So I can't tell you that there's a whole bunch of studies out there that we can research or look into, okay? But, kind of being guided by some of the principles of this vaccine versus other vaccines and things of that nature, I think it's pretty reasonable to say that if you have your vaccine, certainly, within 30 days, 30 days out from your surgery, that's going to be okay. I think even up to perhaps 2 weeks before surgery, that will be okay. So as of right now, I'm telling our patients that you shouldn't have your vaccine kind of within 2 weeks of surgery, within 2 weeks before or after surgery, okay? Do I have any hard, research or scientific evidence for that? I don't, but nobody does. Nobody does at this point. We're gathering all the information, but trying to, be a little bit on the safer side and using reason. That's kind of the guidelines right now. So, try not to have your vaccine within 2 weeks before or after surgery.
So even if a patient does have their vaccine months prior to their surgery, we still test?
Yeah, so again, this is all in flux. Research is still going on. CDC still says, is it possible for someone to be vaccinated, have antibodies, but be a carrier? They say that it is a possibility. As of right now, not all of my staff has been vaccinated because here in Florida, it's not open to basically the general public as of yet. And so therefore, if there's a possibility that they could potentially get infected, then we want to minimize that risk. So as of right now, we will continue with very similar COVID protocols that we've been doing for the past year or so, which does mean that patients will get tested with a nasal PCR test, within 5 days of surgery.
Can you add lipo of the arms last minute before on your surgery day or right before your surgery day, or even at pre-op?
You can. For the most part, you can. If it's something, where it's kind of a short add-on, fairly straightforward, a lot of the times we'll do it because it's not going to add too much more OR time to the schedule. Having said that, we have our schedule is pretty tight, okay? And we kind of plan everything around that OR schedule. So if it's like a bigger add-on, sometimes you can't do it. I mean, what's an example of that? Say someone comes in for a breast lift with implants, okay? And then on like pre-op day, the day before surgery, they decide they want to add a tummy tuck. Well, that's like a big, that's a lot more time in the OR, okay? So now you're going from basically just a breast case to a mommy makeover, and then something like that is going to be difficult to accommodate unless you're like very, very lucky, and for whatever reason we had a light day the next day, which doesn't happen. So kind of a shorter add-on, something that doesn't add too much time, such as say lipo arms or lipo chin. That's probably something that we can do. But if it's going to be something that's going to increase the time in the OR significantly, then that's probably not something that we're going to be able to do.
Do we get regular IV fluids in the recovery room after a BBL?
Yeah, well, you get them throughout your surgery and in recovery. Okay. So while you're having surgery, you're getting IV fluids, and then in recovery, you're also going to get some IV fluids, and of course your cell saver as well.
So everything, this is a question back to the cell saver, all the components of the cell saver machine that are used on the patient, are they thrown away after?
Yes. Right, so that's what I wanted to point out here. So as you can see, they're all sterile, they're all single use. Basically 4 components. So you have that initial kind of suction tubing that's going to take it from the canister from the OR table into the canister. Then you have your big canister here. All right. Then you have your centrifuge, kind of heavy workhorse filtration device there, and then you have that little tiny, kind of foolproof final filter there. But it's all in sterile, single-use type of wrapping, so it's one per patient.
So when it comes to the COVID test, would you take any type of test from your patients before surgery, or is there a specific one that you require?
Yeah, it's going to be a PCR kind of nasal swab type of test, okay? So it's not going to be the kind of the finger stick blood test that just tests your antibodies, but it doesn't tell us whether there's actually a virus in your body or not at that point in time, okay? So it does have to be that nasal swab PCR test.
You have any recommendations to build hemoglobin prior to surgery? Lipo?
We do. So we do recommend all our patients to start on certain supplements that's going to help kind of build up their hemo levels, okay? So at least 30 days before surgery, but you can start sooner if you like. You want to start on vitamin C, which is typically at least 1,000 milligrams a day. You want to do folic acid, which the max you should do of that is 1 milligram a day. Okay, you shouldn't do more than that. And then you want to do Floridix and Hemoplex, which are both iron supplements.
With iron infusions, my level is 10.9 max. Will a note from a hematologist clear me for a BBL?
So no. So for a BBL, you got to be at least 11. Okay. So I know, unfortunately, there's some patients that just have chronic anemia. There's some patients that have thalassemia, and they just can't physically get their hemo levels up to 11. And unfortunately, if you're just not able to do that, and you're just not a candidate, we want to rather be safe than sorry. And so if you can't get your hemo level to 11, then we won't be able to do a big lipo case.
Do we have to schedule post-op massages with the office or Correito, lemon squeeze?
So yeah, you can schedule those with us. So we can take care of that for you. And basically, if you're coming to Pure and you want to do your massages here, we can guarantee that you'll be able to do so with Correito, who's excellent. So big shout out to Correito. Hey, lemon squeeze. So yeah, so you can go through us and we can take care of that for you. Now the one little caveat to that though is that we're not open in the office Saturday and Sunday. So if you are here throughout the weekend and you want to have massages with Correito's team for the weekend, then that part it won't be here in the office. Okay, we can still help coordinate that. Okay, but typically one of our team members will come to you.
But if you had a patient who wanted to go outside of the office and outside of Correito, is that okay?
I mean, it's okay. Of course, like anything, do your research. Make sure you know who you're going to. Make sure that they have a lot of experience with post lipo massage, drainage massage, lymphatic drainage massage. The key is that you really want to go to someone who has a lot of experience and really knows what they're doing. Okay. the post-op care is just as important as the surgery itself, if not more so. And the massages are a huge component of that. I'm a big believer in post-lipo massage. I've seen, you know, all the kind of the best, most outstanding results that you see are from people that have had, you know, that have done multiple post-op massages, typically somewhere around 20 or so. They still do like their weekly kind of maintenance massages and things like that, and they've gone to someone who really has a lot of experience with this, and it makes a world of difference. You know, massages help remove excess fluid. They help get the skin to drape back as smoothly as possible. They help contour the body, and they also help minimize the risk of fibrosis. So extremely important.
Do all your patients wear compression socks during surgery, and could they wear circulate?
So all our patients are wear compression socks during surgery. We actually, we give that to the patient, okay, for the one that they're going to use during surgery, okay? And then all patients have a sequential compression device during surgery as well. So there's no need to bring your circulate device for surgery day, because we have that here, and we're going to take care of that, okay? You certainly want to have it with you for once you leave the facility. Then you want to put on your circulate device, especially when you're being active and when you're sleeping at night.
Let's see if you know this. Which fat is better for transfer, arm fat or inner thigh fat?
Actually, I'm not sure. I don't know that one is necessarily any better than the other. I think they're both okay. So no difference there.
Oh, we're already past half an hour. I know you have to go soon.
All right.
Is there any other things that we have to touch on? We have a few questions about our BMI changes.
All right. Yeah. So a couple things, like little minor announcements we wanted to make. So one of them is we are adjusting some of our criteria. We're kind of tightening our criteria a little bit, and one of those things is the BMI. So moving forward, we're going to be lowering that max BMI to 30. Okay, but this does not apply. Okay, does not apply to people that are currently booked. Okay, so if you're booked, you apply. You know, then you fall under the kind of the older rules, which are the max BMI of 33.5. So please don't freak out. Okay, you are okay. This is only you know, moving forward for people that haven't booked yet, for like new consoles. Okay, so moving forward, and you know, we're booked out through like the end of September right now. So moving forward into like October and the remainder of the year, the max BMI is going to be 30. But not for those that are currently already booked, or those, you know, so don't worry about it. For you, you know, if you're already booked, you don't have to go like, you know, down to 30. You're below 33.5, you're going to be okay.
Thank you very much.
Right. And the other thing that we wanted to announce here today is that stay tuned for next week, because next week is going to be the big Yanisi reveal. Okay, so we had her on here, I don't know, maybe 2-3 weeks ago. So some of you guys may have seen that. Yanisi's had a couple procedures with us here at Pure, and then after that, a lot of people were asking, you know, what her post-op looks like, what does she look like, and everything else. So she is finally ready. So stay tuned, because throughout next week, we're going to be able to show her befores and afters. Okay. All right, everybody. Well, I hope this was very helpful, and you learned a lot about the Cell Saver here today. You know, next week we're gonna go over some more plastic surgery topics and answer all your questions. Okay, so I hope to see everyone next week on Hump Day with Dr. Alex Earle. I'll see you then. Ciao.
Bye-bye.